This is Access Health GY. Have you been experiencing pain, swelling, or tenderness in one of your legs, especially the calf area? These are signs of a blood clot in the deep vein, a condition called deep vein thrombosis, or DVT. In this week's episode of Access Health GY, internal medicine specialist Dr. Persaud talks about this life-threatening condition and measures you can take to reduce your chances of having DVT. Deep vein thrombosis is a condition that not too many people are aware of. And today to talk about this serious health concern is Dr. Persaud. Dr. Persaud, tell us a little about DVT. What is deep vein thrombosis? I know it's commonly called DVT.
Correct. DVT is basically a thrombus or blood clot located in the deep veins, and that's it. Usually, in the lower extremities, we find them.
Okay, what are the signs of a DVT?
Patients with DVT usually would present with some pain to the calf or another part of the lower extremity, and sometimes swelling of that area. So basically, it's swelling of one of the legs, most times in the calf, and pain in that area. Note that I said one, because most times it's on one side.
Okay, so who are more at risk of getting a DVT?
There are many, many patients who are at risk for having DVT. Indeed, I said patients, but I should probably say people, because not everybody's a patient.
Yes, true.
So depending on the mechanism, the patient's risk would include, or the patients at risk or the people at risk would include patients who have had some sort of trauma, and that would have led to damage to one of the blood vessels in the area. For example, patients who have had gunshot wounds or who have had a motor vehicle accident, they certainly are at risk. Patients who are immobile for some reason or another, let's say someone who would have been traveling from New York to India, so many hours not moving about, being immobile, that is one risk factor certainly. Patients who are bedridden, either in hospital or at home. So patients who have had strokes, for example, and are in such conditions are definitely at risk. In fact, anyone who is hospitalized and bedridden for a long period of time is at risk as well, including our patients in the ICU.
So the main symptom of contracting DVT is a pain in one of the legs, so as the calf, or are there other symptoms that someone might observe?
So usually, once it's a deep vein thrombosis, it would present with that pain and swelling. However, because of the fact that that clot might not be stable, it can migrate to other areas. The danger with that is that it could go all the way to the right side of the heart and then into the blood vessels of the lungs to cause something called a pulmonary embolism, and that is life-threatening.
Wow. So before we get to that, is there a time frame that you should or must detect this in order to bring it under control?
I would suggest that the general public just be made aware of what the symptoms are, and if they do have concerns, to definitely seek medical attention at their local health facility first and foremost.
DVT symptoms can be mistaken for conditions like plantar fasciitis, which also causes pain in the lower extremity. Dr. Persaud further explains how to detect DVT, those most at risk, and treatment options.
So plantar fasciitis would more than likely be located closer to the foot and the bottom of the foot. Usually DVTs are more in the area of the calf and a bit higher. Usually lower is not something that we encounter quite often. Beyond that, note that I had mentioned, in addition to the pain, there is a swelling of the one side of the extremity.
Okay.
If there are doubts, there are other investigations that we can order to differentiate, and that is usually a Doppler ultrasound of the lower extremity, whichever one is affected.
So what are the treatments for DVT?
So before I tell you about treatment, I want to just add to those people who are predisposed to DVT, because there's a There are basically three sets of people. People who have damage to the vessels, people who have stasis of the blood or the blood not moving about, and those categories are outlined, and people who have a tendency to have, let's put it this way, very thick blood.
Okay.
Right? That's called a hypercoagulable state. Why I would want to stress on this is because this group includes pregnant women,
Okay.
women using oral contraceptive pills, and patients who have an underlying cancer. And obviously, I would want the population to know that whoever has these other issues are also at risk. Now, how do you go about treating DVT? Because of the fact that there's this clot that's formed there, we generally attempt to, in layman's terms, thin the blood.
Okay.
And give the body an opportunity to dissolve that clot. There are different ways in which we do this, but by and far, we generally tend to start the patient on a blood thinner within the hospital. Okay. And then switch to tablets. This would usually involve a combination of heparin and warfarin. Okay. Warfarin to go home with. There are newer anticoagulants that are available, but I'm just going to outline what we most times use.
And how long does the treatment last?
The treatment minimum 3 months. But usually it's between a 3 to 6 months period, and that is for persons who have had DVT that is caused by something that was a one-time thing. But if that person has that predisposing condition, for example, if they have a malignancy or cancer, or they have another condition that makes their blood prone to form clots, probably lifelong. So minimum 3 to 6 months, maximum for the rest of your life.
So it would be advisable to check for those other conditions if you would have just found out that you have DVT, so you would know how to treat it going forward?
Once a patient is diagnosed with DVT, as part of the discussion that we have with patients, we certainly seek to find out what was the provoking factor. Okay. Because the knowledge of that gives us an idea of how long this patient would need to be treated for. And this is something that would be done by the medical practitioners seeing the patient.
Okay. Is this a condition that has been prevalent in Guyana? Have we had lots of cases of DVT in this country?
Well, I can't tell you if there are any official statistics, unfortunately, but I can tell you from clinical practice that there are many patients with DVT. Most times we encounter women with DVT, and that is because primarily of oral contraceptive pills in pregnant patients and sometimes in patients with malignancy. But it could be in any population. So I could tell you within the hospital, definitely it's something that we are on the lookout for, and we even go so far as to take measures to prevent it.
When we return, you'll get details on measures you can take to avoid DVT.